Hello everyone, welcome back to my channel. I am Shubha here. I hope you like this video. Please do like, share, comment and don't forget to subscribe. Today in this video we'll discuss about the responsibilities of infection control officer and infection control nurse. Appointing infection control officer. The infection control officer shall be a doctor who is knowledgeable in infection control practices, preferably a clinical microbiologist. In the absence of microbiologist, a surgeon or physician can be designated as infection control officer. The responsibilities of infection control officer are defined in the privileging document. The responsibilities of infection control officer are developing and coordinating the HIC program, including follow-up activities such as surveillance, analysis of data and generating reports. Designing, implementing and evaluating IPC strategies using epidemiological principles and statistical methods. Providing consultation and education to staff, physicians and senior management with respect to IC protocols and practices. Coordinating with the HIC committee to determine the strategy for surveillance activities. Conducting an annual evaluation of the effectiveness of the IPC plan, conducting risk assessments at least annually and as needed, considering the population served, vulnerabilities, relevant statistical data and new and emerging infectious diseases. Notifying the authorities about notifiable diseases as per national and state requirements. Continuously developing and implementing improvement programs for patient care procedures and control and mechanisms relating to quality, compliance and infectious diseases. Educating all employees about IPC measures during orientation and on a yearly basis. Educating includes topics on IPC practices and employee health. Ensuring the IC procedures meet standard guidelines, CDC regulations, SOPs by NACO and Ministry of Family Health and Welfare guidelines. Maintaining the occupational health program including pre-exposure and post-exposure prophylaxis. Organizing HIC committee meetings and maintaining minutes of all meetings. Monitoring IC team and ICN for surveillance activities and other responsibilities. Appointing an infection control nurse. A hospital ICN shall be a registered qualified nurse and trained in the HIC program. It is preferable for ICNs to have undergone a short-term training program on IPC nursing. It shall be mentioned in the privileging of the ICN. The responsibilities of infection control nurse are surveillance audit and documentation, hand hygiene audit, HAI rate calculation, linen audit, biomedical waste management audit, water chlorine levels in the clinical area, surveillance cultures, hand hygiene compliance, needle stick injuries, occupational exposure to blood and body fluids. General education for clinical staff during induction and annual program. Hand hygiene, use of PPE, appropriate PPE for various situations and preventing inappropriate use. Preventing needle stick injuries and protocols for needle stick injuries and mucosal exposure, biomedical waste management, linen management, isolation precautions and communication of information, notifiable diseases, appropriate care of central lines, peripheral lines and urinary catheters, method of performing blood and urine cultures and spill management. Department specific education, hand hygiene, care of IV lines, peripheral and central, urinary catheter care, suctioning method, linen handling, biomedical waste management, cleanliness, patient's bedside, window sills, floor, ceiling, AC grills, drinking water area and toilets. Housekeeping staff, method of cleaning, frequency of cleaning. Ensuring appropriate isolation precautions are followed. I hope you like this video. Thank you for watching.